there, my name's Cathy. I'm a registered veterinary nurse in Kibin Veterinary Clinic in Carnarvon, North Wales. I'm also the go-to dental nurse in this practice, which is very good for me because I love teeth, and it's very good for my team as well because I'm the person that they come to if they have an issue and a problem with a dog's mouth. So it works well for our practice, it's very beneficial for our practice. So I'm just going to be chatting to you about what makes up a good dental clinic and how to actually get them up and running, and also the benefits for us as a practice and also the benefits to the owners and the pets as well. So we'll go through what we can do to help our owners and help educate them. So to start off with how to set up a dental clinic, so we need to get all members of staff on board. So we need to get the receptionist taking the phone calls. If they get a phone call with a client saying that they've got bad teeth or a smelly breath dog or a cat or something, that receptionist knows that they've got a dental nurse, maybe a particular one, or even just the whole team as a nurse team can pick up that phone call and actually have a discussion over the phone with the client and then actually get them booked in for a pre-dental check. Vets as well on board, getting them at the consultation, so when they're doing a full nose to tail health check, whether it's a booster vaccination or a repeat prescription health check or something, they want to be looking in that mouth and they need to be writing notes on the client's records about what is going on in that mouth. They also then need to actually help try and educate the client as well. So rather than just saying, oh yes, it's got dirty teeth, let's book it in for a dental sometime, the owners will then probably completely forget that because of all the other things that the vets are then trying to tell them. So we need to then take that a step further. So it'd be a case of, yes, your pet needs a dental, please book in at reception or book in there and then with the dental nurse or one of the nurses to have a proper dental discussion if the vets don't have time. And then likewise it then knocks on with the nurses. So hopefully that client will then be referred to a nurse for a dental check, where the nurses can actually go through the education of the clients and get them to understand what the hell the vet was saying. So, you know, what was bad about the mouth, why is it so bad? So a little bit of gingivitis, you can lift the lip of the pet, show the clients as well. So get the clients having a little look and, you know, having a guzzle around the mouth and explaining what it looks like and what it should look like. It's also handy as well to have equipment on board as well and prepare your consult rooms with paraphernalia, so posters and guidance sheets and that sort of thing to help educate your clients and show them as well, so you can compare a picture on a book to actually what their pet's mouth looks like as well. Hopefully will help get that on board and sink into the clients. Also look at what your situation is in practice, so obviously getting specific dental clinics up and running. It may be that you work better with specific afternoons that will work better, or a specific morning for having a dental session, or it might work better that you have open surgeries for your nurses and dental checks can get booked in at any point. So it's individual to each practice, whichever works best. But again, it's getting the team on board to know that they can book in dental examinations. Also have a look at your staffing levels as well with your nurses and what you can actually offer your clients. You don't want to offer something that you then have to take away because you haven't, you know, planned it properly. So you need to prepare for it and you need to plan for it. Look also to clients that have potentially had dentals in the past as well. So you can run reports depending on your computer system as to what clients have been in the past year or two. Have they been seen recently with their teeth? And again, get them coming back as well. Phone them up, give them a mail shot. And get them in more regularly, you know, at least yearly. If they're not having the vaccinations, again, you can get them having the vaccines. But yeah, get them in more regularly. So again, you can look back at your previous years to see what dental cases you've seen and get them coming back as well and explain this is a nurse service, it's a free service potentially in your practice. You know, we'd like to have a look at your teeth for your pet's health. So it's not just in the mouth that we're looking at either. The bacteria within the mouth can actually affect the rest of the body, and a lot of clients certainly won't know that at all. So any animal that is old or debilitated or immunocompromised, anything with a heart problem or kidney problems, then any bacteria in the mouth, if it's heavy, then that will go into the bloodstream and it will affect the other organs, so heart and kidney specifically. So again, educating the client as to why it's not just keeping the teeth clean, it's not just giving them a nice smelly breath, it's actually helping the animal as a whole. So it's again educating the client the importance of dental care, you know, at home if they can do it.